Hey you guys, it's me Chris. Coming to you today. I know it's been a while since I have come on, and it's basically because I don't have a phone with a camera on it right now. So bear with me. But as far as school, I have started my second semester of nursing school, and it's a lot better. I can say that I actually feel like I'm doing something. Some things are falling into place now, and a lot of things seem easier. However, um, I feel like each semester is going to get harder and harder, and this one is definitely, as far as the clinical work and what's expected, it is harder. Um, this semester we go to the clinical site on Tuesdays to pick up our patient's information, introduce ourselves to the patient, and ask permission to take care of them for the next 2 days. I do like that better because I don't have to worry about, like I did in first semester, trying to cram all my paperwork together, and I have time to do it that Tuesday night. But the paperwork, it has to be done that Tuesday night, all except our assessments, and that takes, like last night, it took me till 12:30, and I had help with my homework, so that scares me. But other than that, everything is good. I passed my checkoffs. I checked off on an IV push medication, and I had a IM injection. And basically, I just needed to know all those sites to do it in, show it to her, push my IV, you know, give my IM shot. My teacher said that it's hard to get a IM shot in clinical, so we may not see as much of that, but we will be doing flu shots at the fair in October, so that will be exciting. My first two tests, first one, I was getting back into the swing of things, and I just was lazy, and I made 81. Second test, I was just lazy again. I didn't even, I hate to admit it, but I really just went on to bed. I was tired, and I made a 76. So it brought my average down to, I think, a 79. But I'm gonna, try to get back into the swing of things and do what I have to do. Um, I am in something called the DEU, where I'm with a nurse, and a nurse is my preceptor, and she kind of grades what I'm doing and show me, just as a teacher would. But I feel like it's less stressful because it's with a regular nurse, and she's more out to help me learn. Not that the teachers aren't, but I feel stressed with thinking I'm going to get a U or a separate with the teacher versus the DEU person. So, um, tomorrow I have clinical at 6:45. So I go up to my floor on the DEU, and I did get to. This is our third week in clinical. I got to do remove staples today. I'm hoping to get an IV tomorrow. I did have IV on my patient, but I didn't have to change the bag or anything because it just wasn't during my time there. But I'm hoping to get that tomorrow because I do need to practice that skill. I did a Lovenox shot in the abdomen, and I, did the 2-finger breaths and all that, and it was wonderful. So, like I said, I'm starting, when you start giving your injections and all of that, you start feeling more like a nurse, you don't feel as in the woods. Think I'm doing better on my care plans, but I would like to improve because I'm not that strong with my where I'm going with it, my interventions for my nursing diagnosis. But as far as my assessments and stuff, I'm doing pretty good on those. I know what I'm listening for. I know what I'm doing. It's good. So I will keep you updated as much as I can. Peace.